What is emphysema? What are its causes, symptoms, and how it can be treated? Hello and welcome to Mini Medicos. Today we will discuss about emphysema. It is an obstructive lung disorder. It mainly involves the acinar part of lung and is characterized by permanent dilatation and destruction of acinus wall. Now what is acinus? This is the image of acinus and it is composed of respiratory bronchioles, alveolar duct and alveoli. Pathogenesis of emphysema. It occurs due to imbalance between pulmonary proteases and antiproteases. Proteases like elastases can destroy alveolar wall while antiproteases like alpha 1 antitrypsin is protective. Tobacco smoking is the major risk factor for emphysema and tobacco contain nicotine which have chemoattractive effects. It recruits and activates inflammatory cells such as neutrophils and macrophages. Now, these inflammatory cells have proteases like elastase and matrix metalloproteases. These proteases can destroy elastin tissue present in the alveolar wall, and once this elastin is destroyed, there occur permanent dilatation of the terminal bronchioles and collapse of alveoli. Types of emphysema. Emphysema is divided into different types depending upon the structure of acinus involved. Centriacinar emphysema. It is most common type of emphysema. It mainly involves proximal part of acinus, that is respiratory bronchioles and alveolar ducts are involved. Alveoli is spared. In this image you can see respiratory bronchiole is dilated while alveoli are spared. It is commonly seen in heavy smokers. Next is pan-acinar emphysema. In this type of emphysema, entire acinus is involved. That is, whole of the acinus is dilated. It is strongly associated with alpha 1 antitrypsin deficiency. And in this type of emphysema, lower zones of lungs are involved. Next is paraseptal emphysema. In this type of emphysema, dilatation occur in distal part of acinus close to pleura or close to fibrosed or scar. It can rupture into pleural cavity, so it can lead to spontaneous pneumothorax. Next one is irregular emphysema. It is most common type of emphysema seen histologically. In this type of emphysema, any part of acinus can be involved, but there is irregular involvement. Most of the cases of irregular emphysema are asymptomatic. Once again, we will discuss about pathology. Elastin maintains the elasticity of alveolar wall. Once elastin is destroyed during expiration, respiratory ducts can collapse and this result in air trapping inside the alveoli. During inspiration, overinflation of the alveoli can occur due to increase in compliance. Symptoms are patient of emphysema that present to us is tall, thin, have exercise intolerance and breathlessness. Tachypnea is also present in the patient. Patient also have barrel chest. It is anterior-posterior diameter of chest is more than transverse diameter. Investigations to be done are spirometry. On spirometry, forced vital capacity of the lung is decreased. That means it is obstructive lung disorder. On HRCT, Blebs can be seen, and HRCT is also investigation of choice. On X-ray chest, you can see that there is presence of flattening of diaphragm and tubular heart. Both of these changes are due to overinflation of the lung, which is due to air trapping. Treatment options are quit smoking as soon as possible. Video assisted thoracoscopic bullectomy is done if bulla is present. Lung transplantation is treatment of choice. Like and subscribe Mini Medicos.